Well, good morning, good afternoon to those who are on today's webinar. We are very happy to have you guys with us today. My name is Loretta Maddox. I am an account executive and compliance specialist for HCP. I have with me today Chad Schiffman, our director of compliance, and Nicole Mark, our marketing manager, and she will be moderating our questions today. So as we move forward, we just wanted to make this webinar as useful as possible as the rest. We want them all to be very useful. But today we really wanted to focus on the response and recovery. And we know that many of you are back to practice. We know that across the country we have lots of changes that are taking place, and we are getting back to seeing some patients and reopening America. So we did want to talk about just some things that we thought would be very relevant to you as you go forward. So the first thing that we want to talk about are the resources that we have developed for you. We have our toolkit, and we definitely want you guys to utilize it. But we have added some new resources to our toolkit. So one is a response and recovery checklist. This is a one-page checklist. It's not all-inclusive, but it does give a good task list of things to look at. Included in the checklist are several links to either additional information from the CDC, or there are also, if you download the packet, you're going to get actually the PDFs that many of these links go to. So we wanted to have kind of a one-stop resource for you to kind of get started with these things. In addition to that, Chad has been working hard on some policies and procedures. We do now have an informed consent for patients, as well as a response and recovery plan that you can put into practice as a part of your policies and procedures. And we're going to talk a little bit more about all of these as we go forward. But in addition to that, we do have some posters that you can, or links to posters. We have these in the toolkit, and we also have these as a part of the checklist. And you can find all of this information in our toolkit. Those of you who are clients, you're probably very familiar with this by now because you've heard me talk about it over and over again. Those of you who may be joining us today who aren't clients, if you're interested in having access to this, please contact us, and we'll have our contact information at the end of the presentation. So to jump right in, let's go ahead and just start talking about first steps. Many of you have probably taken several steps, so you probably aren't waiting to take that first step. But we did want to give you kind of a roadmap to how you can take what you're doing right now and try to organize it into an actual plan. So the first step should be to develop a response and recovery team. Now, as you can see on the slide, that may be a team of one for some of you. Some of you who are maybe in smaller practices, some of you who are handling a lot of this on your own. You know, that obviously, if you can have help, that is best, but it may just be you. And you can still do all of this, and we want to give you these resources to do it. But in a perfect world, we would have different people from different areas of the organization. You want somebody from administration, probably someone that has compliance as a responsibility. But you also want to get input from each area of the practice, because everything that we're going to talk about today is touching on different areas of the practice. This is organization-wide. It is not something that is just in one small part. It's not just related to patient care. It's not just related to employees. It's everything. So having somebody from the front office that's dealing with day-to-day activities, a person from the clinical staff, having a provider involved, and definitely somebody that is responsible for human resources. Now, as a task of the team, there are certain responsibilities that you need to take into consideration. And many of these, I think you're probably already doing. You want to stay up to date on anything that's coming out related to COVID-19 and stay in constant communication with the public health agencies, emergencies responders, anyone that you have to deal with in this particular situation, so you can stay up to speed on the types of communication flow that needs to be happening back and forth. local health departments, state health departments are going to be or are issuing guidance. You need to stay on top of that as well. But I think some important pieces too, because I think you're used to staying up to speed on what's out there, or at least being inundated with what's out there. But also identify within your organization the essential employees, the essential vendors, the suppliers that you need to have in place to maintain operations. And again, you're probably doing that on a daily basis. Then also think about, who do we have as a list of individuals who could perform certain job duties if needed. If somebody that is a key person in our practice has to be out for a COVID-19 related reason or any reason during this particular situation, who can we put in that place? So we really need to be looking at all of our workforce and determine, okay, who's cross-trained, who can do other activities, or do we need to pull from outside? Do we need to have some people that we can call in on a PRN basis? So we want to make sure that we have a good list of those individuals instead of scrambling around at the last minute trying to accommodate the needs in the practice. And then make sure everyone is trained on not only emergency procedures, but also the prevention of illness. And we're going to talk a lot about that today, on how things that you can put in place to help the workforce, make sure things are properly cleaned and disinfected, how to handle patients with either COVID-19 symptoms or with a diagnosis. So we want to make sure that everybody is adequately trained. And then another team responsibility is obviously updating this plan as changes occur. And as you all know, changes are occurring constantly. So this is why having a team approach to this is really beneficial, because then it's not just one single person that is responsible for everything, but that it is that team response. And then again, communication, making sure that as this plan evolves, that we are communicating that back out to the entire workforce, from providers all the way down. So the next steps in the administrative actions of a response and recovery plan have to do with assessing your risk. And you've heard us talk about this a lot, especially from an OSHA standpoint or a HIPAA standpoint. But these were the actions that we thought were the most important. Number one, you really need to walk through your facility and look at identifying areas of potential exposure to COVID-19. And this is, from the front to the back. We need to be walking through, identifying these potential risks. And then as a part of any good risk assessment, the point of a risk assessment is to identify those risks and then develop ways to mitigate those risks. And so from the walkthrough for potential exposure to COVID-19, then we go right into, we need to be looking at a security risk assessment for any new activities that involve any of your electronic protected health information. And we've talked about this a lot, whether it's telehealth, working from home, communicating with patients by text message. And, we'll talk about some situations where that might pop up here in a second. But you need to be looking at those risks as well. Even though we're under enforcement discretion right now, remember that does go away at some point. And then also, we've had a lot of changes to HR policies that impact your employees. So we need to be looking at existing leave policies that are in place and the potential to create new policies that have not been in place before. So we've had to review what you currently have and come up with a plan. And again, developing this response and recovery plan all has to do with, once these risks have been identified, then we've got to put in place things to reduce those risks. And at this point, we're going to switch gears a little bit from the administrative actions, and Chad is going to talk to us about infection control. Chad?
Thanks. So yeah, infection control, that has obviously been a hot topic with COVID-19, as it is with any pandemic, with the flu, all those types of things. But, in our opinion, it has been heightened basically with COVID-19. And as we know, appropriate infection control starts with basically appropriate hygiene. And when we're talking about appropriate hygiene, we're not just talking about appropriate hygiene measures for, say, employees. We're talking about your patients as well, or anybody who visits your facility for that matter. And so what we're talking about with that is, respiratory hygiene and cough etiquette, having things that they could throw away into and proper, disposal things as well. So we're talking about that. And then also, of course, hand washing technique. We've heard a lot about hand washing due to this pandemic, and you see all the jokes going around. Hopefully now everybody knows how to wash their hands, and there's some truth to that. But so when we talk about infection control, I think it really does start with appropriate hygiene. Then from there, we'd like to, really focus on cleaning, disinfecting, and disposing of waste procedures. Now that is incredibly important, especially during this time, because there's just so much potential for infectious materials. So whenever possible, when disposing of waste, I'm going to start backwards on this a little bit. We really want to look at no-touch methods. What types of things can you have in place for those possible secretions in your facilities to try to protect your staff as well as the patients who visit there? And then from there, it's appropriate to think, we want to start thinking about the different areas in your facility. So you have your waiting rooms, how is that set up? What types of cleaning and disinfection schedules do you have going on there? Your exam and procedures rooms, are they being cleaned regularly? What's the disinfection protocol? All this stuff should be part of your plan and built in. Your restrooms, are they clean? Are they properly stocked? That's been a big question that we receive, is how often should they be cleaned, and that type of thing. Break room, kitchen, same thing. What are you going to allow to happen in your break rooms? When are employees allowed to use them, and for what purposes? Do they have proper cleaning supplies in place and all that type of thing? Social distancing, we'll talk a little bit about that here in a little bit. Individual workstations in your offices, do you have assigned workstations? Are they spaced out properly? Who's allowed to use what? Or is there cleaning that happens? All those are considerations that you should think about in terms of infection control. Now, as we move on to the rest of it, we're going to talk about some signage and resources. So infection control signage and resources that should be available in your facilities. As we talked about at the beginning, we have added to our toolkit, but at a minimum, we'd like to see the CDC Stop the Spread of Germs poster in your facilities. Prevent the spread of COVID-19 is another great resource. Hand washing, we know that's been, as we've talked about, even today, that's very important. So posting those reminders in your facilities, the cough etiquette posters, and that's part of the how to protect yourself and others. And then also, again, washing your hands. We have that on there a couple of times. Just, we're going to stress that over and over again, because there's a couple of different posters that, one's better for employees and one's better for staff, and all those are available as part of the toolkit. All right, so after this slide, we're going to go talk about PPE. The next probably hot button item that we hear the most about is PPE and how to manage it, in a crisis situation. All those types of things, and during the pandemic with the shortages, there have been a lot of considerations that employees have had to consider, for the essential workforce and different things. So part of that was determining what is actually appropriate PPE for COVID-19, particularly with patients who have the diagnosis or symptoms of it. And CDC guidance does recommend a respirator, face mask. We know that. Eye protection could be appropriate for a lot of procedures that are happening, particularly if there's a risk of any droplets. Gloves, that goes without saying. And a gown might be appropriate, especially if there's a COVID-19 diagnosis that you are definitely aware of. Now, your workforce members not providing care to patients, the biggest recommendation that the CDC and other agencies have is just how they can maintain appropriate distance, that social distancing, if you will, that 6 feet barrier or so if possible. But even then, they have an option to where, and we encourage for the time being that workforce members do consider face coverings if they are in a patient-facing capacity. But if it's maybe a patient that's in the, a workforce member that's in the back office, might be away, at least provide them that option. Now, if you have a clear policy that says, yes, you are to wear a face coverings, then of course they should. But at the very least, at least offer them the opportunity if they're in a non-patient facing capacity, say like a billing office. So next slide. All right, so some additional resources that we provided links to, appropriate donning and doffing of PPE. That's probably one of the number one trainings for employees to take right now. Making sure they understand how to properly use it and when to use it when caring for COVID-19 patients. This link does provide that for you. We don't want to recreate the wheel, so we believe that the CDC's version is really good. So we just wanted to provide that for you. Reuse of PPE during shortages are some great strategies on this link. It talks about some considerations that you can do in the event that you have some shortages. If any of you have any questions about any of these topics, please do send them to us today and we'll be sure to answer them. Also, face coverings. This particular one talks about the do-it-yourself cloth face coverings, the instructions for that. But in addition to that, the CDC does have the guidance out for what to do in the event that you can't get face masks, some alternatives that are there, or respirators and that kind of thing. So we encourage you to check those out and make sure this information is passed on to your employees.
Right. And this is information that we do have directly linked from the checklist. If it's easier for you guys to take a look at it that way. We know we are giving you a ton of information because there's a ton of information out there. So the way, and we do think it's the best information to have at your fingertips. So that's why we wanted to put it together in a more concise location for you. So now let's move on to just interacting with your patients. And some of you may be doing these things already, and we're going to talk a little bit later about our next week's webinar, but go ahead and start thinking about experiences that you guys have had in your practices currently. We would love to hear those experiences, and we'll give you guys some instructions on how to send those in to us in just a bit. But from a screening standpoint with your patients, clearly this is something that we need to be doing prior to the patient coming in. And so we have actually Chad developed a screening script, which is a very useful tool, and it has lots of information for you to kind of go through for the folks that are on the phone, or if you're doing screenings in person. But we basically need to be asking, are you experiencing any of the following symptoms? Or have you had recent contact with anyone who has tested positive, or close contact with others who have symptoms but haven't been tested? And the timing of when you should do this, you're going to have different situations, but if your people on the phone, when patients are calling in, clearly that's the best time to be doing these screenings. But that may not always be possible. And even though it may be possible at the time of the appointment, things can change between the time of the appointment and the time of arrival for the patient. So prior to those patients entering the waiting room, we need to be doing the screening again, or initially if that's the first time you're coming in contact with them. There are ways that you can incorporate this into your practice, and we would really like to hear if any of you have incorporated those types of procedures. But, letting the patient know when they call in to make the appointment that they need to call from their cell phone, and let the office know when they're there, and then someone will come out and do the screening at the car, or, to have that communication. That may not always be feasible for some of our patients. We would think that everybody has access to a cell phone, but not everybody does. So there may have to be alternative measures put in place for those patients. But I think for the majority, we're going to be able to have that interaction. That may take place by a text message. It may be a phone call. And this is what I was talking about earlier. We are communicating with patients in ways a little bit different than we have in the past. So as we move forward, we need to make sure that any type of communication that's involving protected health information, that we're including that in that security risk assessment. Now, if the patient answers yes to either of those questions, then that's the point where we're either going to defer the appointment or possibly try to convert it to a telehealth visit. So you need to have those procedures in place as well. If neither of those options are feasible, then we need to try to schedule those patients at a time where they can be isolated from other patients as well as exposure to non-essential employees if possible. So maybe schedule those appointments at the end of the day. So at this point, I'm going to shift it back over. Oh, I'm sorry. No, I'm not. I'm going to talk about one more slide and then shift it back over to Chad. When the patients arrive at your facility, we did talk about this briefly. We can have a staff person at the entrance of the facility and making sure that we're asking those patients again about their symptoms. If there are symptomatic patients, if you can have the availability of face masks or tissues, something so that they can cover their mouth and nose. And then again, also, we're going to try to limit the number of people that are coming into the practice. We've all experienced patients before who have brought their entire family with them to the visit. We know that. We've all been there. Any of us who've worked in healthcare for any amount of time, we want to try to limit that. So we need to be instructing our patients about that as many times as possible on, when they're making the appointment and any other interactions you have with them. We're going to limit those non-patient visitors. If you are bringing patients into your waiting room, we're going to try, anyone that's sick, let's try to leave them out in the car as long as possible if you can, if they're medically able to do that. If not, separate your waiting room if possible for sick and well patients. We've seen this a lot in pediatrics, and it can be done in other types of practices as well. So let's try to have a section for those patients that are experiencing symptoms or are sick, and then let's move those patients to a private room as soon as possible. And this information is directly from the CDC, along with a lot of other information which can be found at this link. And now, Chad, it's your turn to talk.
All right, and so before we move on from patient interactions, I think the one more thing, and I guess it kind of ties in here, is one of the forms we've been asked to create, and I don't know, maybe you touched on this and I didn't quite hear it, but is the COVID-19 informed risk consent. So now informed consent. So what we've done is we've put together a form for your patients that you can use that is basically talks about, if they're opting to come in for a non-urgent appointment or a procedure that may not be considered medically necessary at the time. So we did create an informed consent for that, especially as a lot of the workplaces are getting back to seeing these type of visits. If that's something you're interested in, do let us know, or it is available in the toolkit, and we'll be sure to get that to you. So now, as we're moving on to the waiting room, we want to talk about what your waiting room consideration should be. And the first thing that we want to talk about is making sure there's appropriate supplies in there. And she talked about tissues. That's a very useful thing to have in there. But in doing so, you want to make sure that you have, those no-touch trash receptacles in there. Nothing that requires them to lift a lid with their fingers or anything like that. If available, alcohol-based hand sanitizer. We know that CDC recommends that first and foremost. But if not, definitely make sure that there's access to sinks with soap. Actually, in addition to, I should say, we want to make sure that you do have access to sinks with soap for all of your patients and then also your employees. In your waiting room, you want to make sure that you remove all toys, reading materials, remote controls, basically anything that's a fomite that can be touched and handled and get contaminated, you should remove that. Now, you could have them available upon request in certain circumstances. So let's say that, somebody's going to be there for quite a while. Perhaps you could have those available upon request. And if you do, just make sure that you have, cleaning procedures in place for those. Seats, we'd like to see those spaced about 6 feet apart in most circumstances, with barriers if possible, even just an end table in between. Obviously, putting plexiglass in between each one isn't practical for healthcare facilities. So just whatever you can put in place to try to encourage patients to sit 6 feet apart is ideal. And if you do, let's say you do have some exception visits that are coming in, somebody that requires a caregiver, and that's the only way they're able to be seen, you can make sure that there's a seat available for them. And this obviously depends on what your rooming procedures are, especially in the time of this pandemic. Education signage, we talked a little bit about that. Once again, it's hand washing, cough etiquette, proper disposal, that kind of thing should be posted in your waiting room. Next slide. Now, workforce. We want to talk a little bit about workforce members and screening them. We believe all workforce members should be screened for COVID-19 symptoms and referred for testing when appropriate. If they develop those respiratory symptoms, the cough, the shortness of breath, that kind of thing, should be instructed to not report to work. Have your sick policies implemented. Make sure that they are definitely non-punitive. We want to be very careful with these sick leave policies right now. And if you have any questions about that, we can certainly take a look at your existing policy and see if we have any suggestions. But quite often, some of these types of things do end up teetering on that legal advice. But sick leave policies for the most part are pretty straightforward. Movement and monitoring decisions for workforce members with exposure to COVID-19 should be made. So, anytime that you have a patient, or one of your workforce members who does in fact have a positive diagnosis, make sure you're working with your public health authorities on that. And so social distancing, the term that we're all going to be tired of by the time this whole thing's over. Or is it the new normal? I don't know. Those are all those terms that we're hearing nowadays. Both, yeah. We'll probably. So workplaces that, if you can and where feasible, try to have your workforce members of 6 feet apart. Now, we understand in some office locations that's not going to be feasible. So, that's when you can start looking at, okay, well, should these employees be wearing face coverings? Are there other types of barriers that can put in place? Now, in my personal opinion, quite oftentimes once you're exposed to each other for long periods of time, you're already there. So, but still, those are just strategies that you should have in place. Definitely don't hold any large in-person meetings whenever possible, unless you can have some social distancing spacing in there. A big round table with several people sitting at it far enough apart, that's one thing. So you just want to try to make sure that you keep the meeting short, to the point, and maintain that social distancing for now until guidance changes, of course. And often, a lot of this is going to depend on your localities as well as your counties issue certain guidance and your states. So always be keeping up with that. Your break rooms, we recommend avoiding those whenever possible if social distancing can't take place. So consider staggering those breaks so your employees go in at different times. And it might be usual for a group of 5 or 10 people to get together and eat lunch, but for the time being, that's not encouraged. So stagger them as best as possible. Make sure these break rooms have cleaning and disinfecting procedures in them as well as for your common areas. Don't forget about some of those areas that we normally take for granted, like the lobbies and those types of areas. And finally, restrict the sharing of workplaces, phones, pens, staplers, etc. If you properly clean them, that's one thing. Some facilities and some organizations we work with have multiple shifts. They have AMs and PMs and they share workstations. But what they have done and what we've encouraged is that they make sure that they're cleaning those, those devices that are shared. Next slide.
All right. Thank you, Chad. Now we're going to talk about our high-risk members of the workforce. So we have to look at, and really this is based on the request of the workforce members who are high risk. It's not, I think it's a slippery slope if you were to go in and start identifying all of your patients or all of your employees that you determine are at high risk. So we want to remember that this is at the request of members of your workforce who are high risk. So we want to, do you guys hear that echo, or are we good?
I think we're good. I don't hear an echo.
Okay, sorry about that. Okay, so we want to make sure to provide any type of alternate work assignments, and this may be, working remotely or maybe alternate work locations within the practice, and obviously taking into consideration any social distancing measures. That's really the first step, is making sure that we're trying to put these members of the workforce who have self-identified as being at high risk, that we are giving them alternatives to be out of the general population of other employees and clearly patients. If alternate work assignments are not possible, then we want to be able to have the flexibility to permit high-risk employees to use obviously any of their accrued paid time off, or to elect to claim unemployment. In addition, we want to also make sure that we're maintaining any type of employer-related health insurance benefits for employees that are eligible for those benefits until the employee is deemed eligible to return to work. So if they do have to be, off for a little bit, then we want to make sure that we are continuing those benefits. Now, the reason I have seek legal advice when making determinations that could result in termination is because this is a very tricky area. High risk, any of you who have had to deal with ADA situations with your employees, you've probably dealt with similar situations, and so you may be already aware how difficult it sometimes can be to make these determinations. So you can clearly call us, and if we can provide some assistance in pointing you in the right direction, but sometimes it does truly require some legal advice in these particular situations because we want to make sure that we're doing everything appropriately. The EEOC has a lot of resources. They have some really good frequently asked questions that are available at this link on the website. This particular link on the slide, this slide is not included in the checklist, so I definitely wanted to point that out. We can get that added because, again, this does really, they really do provide a lot of good information. So finally, we're going to wrap up with reporting before we talk about next week's webinar. Obviously, reporting test results, positive test results to local and state health departments, that's something that if you are doing those testings for your patients, then that would be something that would be reported. The workforce, we want to designate someone on staff that workforce members can report to with either a COVID-19 diagnosis or any related symptoms. I want to remind everybody that this information has to be kept confidential. And right now it's very, this is such a big topic and everyone's talking about it, but we do have to remember if you have an employee that reports to you that they have COVID-19 or any related symptoms, that's not something that we're sharing with the rest of the staff. However, I'll talk about in a second what you can share. But also remember, you can't retaliate against any workforce member for reporting their diagnosis or related symptoms. And we want to encourage our staff to tell us. We don't want them to feel like, I'm going to get fired if I report that I've got this, because then that's just going to continue to spread if they're coming to work with symptoms or with a diagnosis. So we want not only to not retaliate against them, which I don't think any of you would, but we want to let them know that there's not going to be any retaliation. From a privacy standpoint, obviously, if you were reporting test results for your patients, that is a permitted disclosure under HIPAA to public health authorities. The workforce. So the employer is, again, required to keep employee medical information private. And this is something that's interesting to think about. If you are taking temperatures of your staff as they're coming in, that's actually part of a medical exam. So you have to, or it's medical information. You have to keep that information confidential. So whoever is taking those temperatures, that individual needs to understand that's not something they need to be talking about. So all of that information needs to be kept confidential. Now, what you can do, if you have an individual who has either been exposed or they have a diagnosis, you can let other workforce members know that there is a potential exposure, but you may not disclose the employee's identity. Now, some of you who have small practices are thinking there is no way in the world that's ever going to happen, right? It may not, but it's your responsibility to make sure that you do your best to keep that from happening. So if you have 5 employees and Sally all of a sudden isn't showing up, everybody's going to figure out Sally might be the one with the diagnosis, but as an employer, that's not your role. You have to keep that information confidential. So again, I want to point back to the toolkit. We have new resources available. Chad talked about the informed consent, and I'm sorry, Chad, I talked about that at the beginning, but I'm so glad that you remembered to talk about that because, guys, that is a really good resource because it completely outlines the risks and that the patient is consenting to have those, to have these elective procedures or to come in. So in addition to the toolkit, we also just want to remind you that moving forward, we know that there are going to be questions, there are going to be changes, and we want to be there to help you guys with that. One thing that I do want to mention that we've mentioned the last few webinars is the Provider Relief Fund. I know you guys may be tired of hearing me talk about it, but the thing I want to mention now is we are very close to that first 30 days from receipt that you need to attest. So anyone that received funds on April 10th, you have until May 10th to attest to and accept the terms and conditions, or to complete information that you're going to be returning those funds. But it is important that you go out to the portal and that you get that done. Another thing I noticed when I went out on the portal this morning is that there is a general distribution portal, and that is new. And if Medicare providers who did not have adequate cost report information, or providers that may be like pediatricians, children's hospitals, you must use this portal to submit a request. So that information can be found at that link. And then for the COVID-19 uninsured program portal, it is also available at this link. And this is for providers who have conducted testing for uninsured individuals after February 4th. So you have to use this portal in order to request reimbursement for that. So now talking about, again, moving forward, we are going to do another special webinar next week on Tuesday, May 12th. And we really want to focus on best practices and lessons learned. So those of you who are already doing this, you are probably doing some of the things we talked about today. Chad and I aren't actively in offices doing these things on a daily basis. So this is where we need your help. Please share with us any stories you have, lessons that you've learned along the way. We would love to hear that. So please send us your questions or experiences. You can call us, you can email us at support@HCPMD, but we do want to hear from you. So now, if there are any questions, we are happy to address those. Nicole, do we have any today?
We do. Okay, one of the questions here, do temperature checks for employees have to be done by one person, or can we have a spreadsheet that each employee has access to and enters their own result into?
So I think, go ahead, Chad, do you want to address this one?
Well, I was going to say, I think that's just, once again, a matter of your policy, your internal policy. I think that spreadsheet would be fine, assuming, if you have someone come in, if there's a thermometer that they're coming in and using and entering, that should be okay. I don't see an issue with that, but once again, that would be based on your policy. I don't know. I think our preference is to have somebody doing it, but if not, if you're trusting your staff, that would be totally fine to have that spreadsheet, them enter it.
I think having a spreadsheet to add on to that, I think, and letting, employees, if they're going to self-report, that's might make it easier. The only thing I'm a little hesitant about on the spreadsheet is, and this, I think I heard this in the question, and Nicole, if I didn't, correct me if I'm wrong, but it's going to be accessible to everyone. That's the part that makes me a little nervous, because again, we talked about how we've got to keep employee medical information private. So if that spreadsheet's accessible to everyone and it's got everybody's name and everybody's temperature on it, I think that could be an issue, especially if you've got somebody that's going to report a fever. So then now all of a sudden everyone that has access to that spreadsheet knows it. So if there is a way that employees can report that without everyone else having access, I think that would be okay.
Yeah, maybe it's their individual log that they're reporting it on or something like that, and it's provided to their supervisor, you know, or whomever is assigned to it. But ultimately, I think it's just limiting who has access. I'd agree with that for sure.
Okay. Another question here, is there a consent or waiver for employees?
So that is actually something that's in development and almost put together, but yes, it's actually being drafted as we speak. We just want to put the finishing touches. We'll be sure to add that to the toolkit. There was just a few challenges in getting all the information in there. We just wanted to basically dot the I's and cross the T's and make sure it looks good and, you know, covers the bases. But yes, that will be developed and added to the toolkit. I'd expect that in there by today, actually.
Great. That's our last question today.
All right. Well, thank you all very much again for attending. And please, as we've mentioned, we do want to hear from you. So if you are doing something that's absolutely fantastic in your practice, please share that with us, because we would like to share it with others, and we'd like to learn from what you guys are doing out on the front lines. And then again, if you have questions about how to implement some of these new procedures, send us those as well, and maybe we can we can either research it and provide you answers, or maybe some of those of you out there that are doing it and it's working, we can share that as well. So again, thank you for attending, and we can't wait to talk to you guys next week. Have a great day.